Most students gravely misunderstand hypoxemia. And if that is you, stick around for 3 minutes and I can absolutely clear this up with no confusion. All right. This is a huge concept for NCLEX exams, and hypoxemia we'll see in a lot of diseases. So this is absolutely vital. All right. So let's start at the beginning. Hypo means low, ox means oxygen, emia means in the blood. So low oxygen in the blood. There's two places that your oxygen can be. It can either be inside the blood or it can be inside the tissues, all right, or inside the cells. And this could be any cell. This could be heart cells, kidney cells, butt cells. It doesn't really matter, all right? These are your cells. So we know that red blood cells' job is to carry oxygen. So you see these red blood cells are like little Ubers, all right? And they have 4 seats in each Uber that the oxygen can sit in. So those little blue dots are each one little seat of oxygen. So the red blood cells are going to take the oxygen from the lungs and they're going to go down this road until they find some cells that are like, you need some oxygen, okay? And the 4 little guys here that are sitting in the Uber are going to hop off. 1, 2, 3, 4. They hop out of their Uber and they're going to go boop, 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 boop. 1, 2, 3, 4. And they're going to jump into the cells because the cells are what need oxygen. Now, I have asked thousands of nursing students, what is oxygen's job? And the only answer I've ever gotten is, you need it for life. Well, yeah, but let's talk about what it actually does and why people get hypoxemia and then what the problem is, all right? So once the oxygen is inside the cell, it's a little fire here. So the oxygen is going to start this little fire that's going to burn our glucose, all right? Glucose is our energy source, but we can't readily just use it. It needs to be transformed into ATP. So oxygen that gets in the cells is going to start this little fire, and it is going to burn the glucose that you eat and the carbs that you eat into ATP, which is usable energy for your body. We can't use this. We can use this. So if your patient does not have oxygen, there's no fire. There's no burning. There's no glucose burning into ATP. Your cells cannot use energy and your cells will die. That is why hypoxemia can lead to death, because the cells start to die if there is not enough oxygen in the blood. And then hypoxemia, right? Not enough oxygen in the blood will lead to hypoxia, which means not enough oxygen in the cells and tissues. And if there's not enough oxygen in here, there is no fire. We cannot burn glucose. There is no ATP. Your cells have no energy and your cells will die. And then so will the patient. So this is the basis of hypoxemia. This is how patients pass away. This is why oxygen is important. This is why if we don't breathe oxygen, you die. It's because of this concept. And once you understand it, most of our disease process will end up leading to hypoxemia, which leads to hypoxia, which leads to death. Do we understand? Amen. Amen. Now, cyanosis is typically one of the biggest signs and symptoms that we see. They're going to start turning blue because there is no oxygen to burn glucose into ATP. And remember, high yield NCLEX, first sign and symptom of hypoxia, restlessness and confusion. So your patient starts acting kind of funny, kind of restless, kind of confused. It's because they got hypoxemia, not enough oxygen in the blood, led to hypoxia, not enough oxygen in the cells, no fire to burn glucose into energy, no energy for the cells, cells die.